Good morning, everyone. Welcome to our sixth Project Echo session for addressing barriers to healthcare and cancer prevention screenings for adults with intellectual and developmental disabilities. We're so excited to have everyone in our Zoom room today. My name is Michelle Jansen, and I'm the Community Outreach Coordinator here at Rutgers Cancer Institute of New Jersey. And as the state's only NCI designated comprehensive cancer center, our goal is always to prevent cancer before it starts. In New Jersey, cancer is the second leading cause of death. 1 in 2 men and 1 in 3 women at some point in their lifetimes will develop cancer. And we know that those with an intellectual or developmental disability experience greater health disparities that can then lead to a reduced rate of cancer prevention screenings and later diagnoses. Before we introduce our moderators and presenters for this session, we'd just like to share a few tidbits of information about our Project Echo series, especially if this is the first time that you're joining us. We encourage everyone to have their cameras turned on if possible to encourage the flow of dialogue, as well as the exchange of information and resources throughout the session. We'd also just like to remind everyone that when you're not speaking, just to make sure that you're muted to minimize any potential background noise. But we do encourage you to unmute yourself throughout the session to provide feedback and suggestions for the dialogue portion. If you're unable to do that, there's always the chat box. We'll actively be monitoring that chat box, so please feel free to share your thoughts, and we'll be sure to get that out to our Project Echo participants today. So the first part of our session is going to involve an evidence-based presentation that's then going to lead us into a case study about best practices and developing solutions for common challenges that we may all face in our practice and provision of services to individuals with special needs. Everyone in our room today is an expert in their own right and through their own unique skill set and experiences. Our goal is really to bring all of these combined skill sets and experiences into one place where we can discover new approaches, build a set of evidence-based practices, as well as to share resources and connections to enhance the care that we provide in our different disciplines. I'd like to start off by introducing our moderators for the session. This is what we refer to as our Project Echo Hub team, and we're going to be with you for the next 2 sessions together. And our goal is really to help facilitate and guide the discussions, moderate the chat box, and just get the conversation flowing back and forth. We're also going to be sharing a box folder with everyone at the very end of the series that will have resource guides for each session, all of the recordings, and any resources that we share in our sessions together. So before we get started and introduce our speaker for this session, I wanted to introduce Laura Stanzelis O'Reilly, Executive Director from the North Jersey Health Collaborative, who's going to introduce our speaker and topic for today. So welcome, Laura.
Thank you, Michelle. Hi, everybody. Hello to familiar faces and welcome to people that I have not had the pleasure to meet yet. This is a very important topic, and we're all here because we have an investment in helping individuals with developmental and intellectual disabilities. I just want to share with you also that the North Jersey Health Collaborative is working with ScreenNJ, Michelle's organization, and Mary Ellen Zung, who's on this call today, will be presenting colorectal cancer screening information for adults with intellectual and developmental disabilities. So that's one of the takeaways from this overall presentation as we address the barriers to healthcare and cancer screenings. The North Jersey Health Collaborative is doing a spin-off activity focusing solely on colorectal cancer screenings for the population. So you may see some invites from us in your inboxes for these sessions. If you could share them out with your clients and family members of your patients and clients, that would be very helpful. I am really honored to introduce Jocelyn Berrios, who came to us while she was still at Children's Specialized Hospital. She is now in private practice, I will read her bio to you because it's quite impressive, and she brings a lot of levity and information to the table today. So Jocelyn, MSW, LSW, is a licensed social worker who earned her master's degree from Rutgers University, Graduate School of Social Work, and her bachelor's of arts in psychology at the Pennsylvania State University. Jocelyn is a psychotherapist, say that 5 times fast. Jocelyn is a psychotherapist at Integrative Institute of New Jersey, and she specializes in working with children, adolescents, and families. She works with clients presenting with a range of therapeutic concerns, including anxiety, depression, trauma, domestic violence, emotional dysregulation, neurodiversity, grief and loss, and co-occurring mental health conditions. She has extensive experience working in multiple medical settings, including Children's Specialized Hospital, RWJ Barnabas Jersey City Medical Center, and Bonnie Bray Residential Treatment Center, where she provided support and assistance to individuals and families with varying physical and mental health diagnoses. So thank you, Jocelyn, for all the work that you've done and you continue to do on behalf of individuals with special needs. And we are looking forward to hearing from you now.
Thank you so much. Thank you for your kind words too. And thank you for having me here today. It's nice to see you all. I'm Jocelyn. I am part of the ECHO team for ACEs. I see Ashley on the call. She usually joins us too. So I just wanted to preface my case with that information because it kind of has more of the ACEs lens, but of course, touching on barriers to healthcare and how we can better serve our families and our patients and clients. So what I'm going to do here is share my case with you all. So I think this is a little different than the normal presentation. I'll be showing you a case that I had, and I wanted to bring that forward just for more discussion and to kind of dissect the different things that we can help families with. Let's see here, share screen. So this might look a little bit different for you guys. I have a Mac, so I apologize. All right. And can you see everything okay? Okay, great. Okay, so during my time at Children's Specialized Hospital, I worked within Newark, Jersey City, and Bayonne. And we had many complicated cases. We had many concerns for families that we were addressing within the community. One that came forward was one of the physicians that I work with mentioned that they were concerned about a 2-year-old patient that had many different diagnoses that she hasn't been able to see in the office. The parent had canceled many times. And finally, she believed that the patient was coming into the office that day. So she was like, please, can you meet with this mom and see what's going on or how we can help? So of course, as a social worker, I'm like, sure, let's do it. So the child had missed many appointments, as I mentioned. And when the child was finally seen in the office, I spoke with mom in my office after the appointment and just kind of asked her, is there anything we can help with? Is there anything that's going on that you might not have mentioned in the appointment? And the physician did have some concerns just with the appearance of the child. The mom, the child's baby bottle was filled kind of dirty. Mom just appeared disheveled. So we were just a little concerned too, wanted to make sure everything was okay. So they were there for a neurodevelopmental pediatrician appointment. And so when they came into my office, I just asked mom what was going on. Were there any concerns with her? And she opened up a little bit. She said it's hard to get to the appointments. And I was asking if it's a transportation concern or if it was too far for them from their home. I knew they lived in Newark. And mom had mentioned that she had a history of trauma. She had experienced trauma within her community. So in Newark, just a trigger warning, this is a little graphic, but she was stabbed at one point when she was a teen and held captive in the person's home. And she went into that detail and I just took a step back and I was like, whoa, first of all, thank you for opening up about this situation and trusting me with this information because I know that's difficult. And number two, thank you for being here. You're here in Newark. You got out of the house today and you were able to bring your child to this appointment. So I know how difficult that could have been just due to what she was explaining. So now she feels, and she's gone and gotten diagnosed with agoraphobia. She's scared to leave her home for, of course, clear reasons. And she then cannot take her children to the appointments they need, to school, to anything outside of their home. So this is a big concern for their healthcare. So the child had developmental delays and could really use some more resources, support, early intervention, various resources that she was not receiving at all, just because mom was not able to even step outside of their door. So mom also reported there were other things going on in the home. So they had a rat infestation. The landlord had just left the home and the home had been foreclosed and the family was squatting in the home, mom said, and the family had nowhere else to live. They were struggling to pay the bills at the time before the landlord left. Utilities were still working at this time, but they were unsure of when they would shut off. Mom was open to using food banks and SNAP food benefits. Also, I asked if they needed clothing, shoes, household items, just because, as I mentioned, they appeared disheveled and had ripped clothing. So I just wanted to make sure that they had those resources as well. And then she opened up more about how the school was calling mom over and over about lateness and about not arriving, and too many missed days of school, and that the child might fail. And so this was heartbreaking to me because the school was unaware of anything that was going on at home. So they were unaware of mom's condition. They were unaware of why the child is missing school, and instead kind of just blaming mom, why aren't you bringing the child in? And this was just really breaking her down because she's a great mother. She cares about her child. She just has trouble getting outside due to her trauma that she has not even been able to work through yet. She didn't trust anyone to open up or to go to therapy or to work through that trauma history. So there was just a lot going on. So the family was worried about being homeless soon, the lack of food, the lack of support. And then we discussed early intervention and the importance for her daughter. And mom had said that she didn't even want anyone in their home just because she was embarrassed of how it was too with the rat infestation, and that it was dirty, and that she just didn't have the energy to clean and to even just go outside and get cleaning products and things like that. So we discussed different options too, which I was unaware of. I had to look into this more too, that early intervention is able to perform their PT, OT, speech, and DI, so developmental intervention. They can do that outside of the home, even at a park or somewhere that's a safe area for the child and the parents and the interventionist. And that might have toys or different things that they can utilize, but it doesn't necessarily have to be in the home. So I thought that was a learning experience for me as well. So I let mom know about that. Okay, so the key stakeholders here are individuals with IDD, parents, families. As I mentioned, just being able to understand families and where they're coming from, and that there could be different things going on outside of what we're seeing in the office. So I also included healthcare workers and the ability to assess the patient as a whole. So I know, as I mentioned, I have that ACEs lens, and I'm sure everyone's starting to gain that as well in the healthcare field, adverse childhood experiences and better screening for that, and understanding that the patient as a whole is important for their healthcare. And if anyone has any questions, please feel free to jump in or raise your hand or type in the chat. I don't think I see anything in the chat right now, but feel free to jump in. We don't have to wait till the end. And then the local related issues, I had included providing the most helpful resources as well as warm handoff. So that is a huge component to it, is that warm handoff to the resource, letting them know I might have a family coming later today, and you don't have to give the whole background, but just letting them know and helping them be aware that this family needs a lot of support. These might be their questions, letting the mom or the patient or the family know that I called before, so they know you're coming, so they can feel a little bit more welcomed and comfortable. And then just providing the most helpful resources and double checking that these resources are still available through the pandemic, or If their phone numbers still work, I'm not sure if all of you are familiar with that, but I usually have lists of resources and I'll go through and I'm like, oh, great, this phone number doesn't work anymore, or this email doesn't work anymore. So just making sure of that, and the phone or the hours too, making sure that their hours are still the same through the pandemic. I know some are mostly working from home, some have shorter hours. So just checking in on those things before sending a family there and kind of making them run around all over. If we can prevent that, that would be great. Okay. The national related issues, I had included our screening and assessing for ACEs and social determinants of health. I think these are just huge right now, and it's definitely a movement. At Children's Specialized Hospital, I was lucky to be a part of the pilot screening process for ACEs within Children's Specialized. So that was in Newark. So we really got to experience that and see how much of a difference we could make. So basically through the screenings and social determinants of health, we were able to identify that a lot of families were having a lack of food. They had a lot of food insecurity. So we were able to make a connection with the community food banks of New Jersey, and they started sending donations to us. And we were able to provide those donations to the families. So those screenings were also creating connections within the community. So that was really huge for us too. And that could be really helpful for your practices and your offices as well. And then the importance of understanding our clients and patients as a whole, as I mentioned before, that there could be other things going on outside of the office, such as this child that we were maybe seeing behavioral issues, could be due to a lack of food, could be due to not feeling safe in their home, or that their mother is going through trauma at home. So things like that that we might not hear in the office, we'll just hear my child has behavioral issues. And we're like, okay, well, we need some more information. So I think just understanding that can be super helpful to better understand the patient and the family. Okay. And then governance issues, funding and protocol for screening. I know that's a big concern, as I mentioned in our ACEs Echo. I did a whole presentation a few weeks ago on screening in general, and there's mixed opinions. We just want to make sure that we're doing it safely and providing those resources needed, but we need more research and more information. But I think screening in general just can be so beneficial and can help the family feel understood and cared for. Better understanding of how to support families, parents and families who face barriers to healthcare due to their diagnosis. So I know that's what this whole session is about, which I love, that there's so many barriers to healthcare. And I think understanding our clients and their diagnoses and what they present with, and just understanding where they're coming from, can help us to better serve them. And then reliable transportation was something too that I feel like I want to continue to advocate for within the state of New Jersey. In the last Echo session, I know we in our ACEs Echo, we were discussing logistic care and motive care and the barriers with just using that, and how so many of our families use that transportation, but are late to appointments or have to completely miss their appointments due to that transportation. So that's something that I think I want to continue to advocate for. But if anyone here has any recommendations, please let me know. All right. So the outcomes here. So the anticipated outcomes would be that the child and family would be more understood and receive more assistance and support if providers knew all that the family and the child face outside of their appointments. So this would help all of us to better serve our families and children. And without this intervention, the child will continue to miss their appointments, right? And will not receive the help and support that they need. So just as we were seeing, as when the child came in that day, the physician was like, they haven't been here, what's going on? Why aren't they here? And they're upset that they're not able to schedule a new appointment, yet they're missing all their appointments. So there was just a lot of confusion. And I think this kind of helped us to better understand, like kind of set off the light bulb, like, oh, okay, this is what's going on. This is how we can help. And the mother will also not be able to seek help and assistance for herself as well if without this intervention, without us asking more questions. So then I was able to give her resources for therapy for herself and for trauma therapy and for more support within the community, for for violence, especially within Newark. I had many families that were victims of gun violence, which is a whole different topic, I know, but it's just as important, and it's happening within our communities. And also to mom to mom, or yeah, mom to mom, that hotline has been super supportive and helpful for many moms that I've worked with. So I gave her that information, and just the fact that she was able to open up and discuss this and help us to understand the barriers to her child's healthcare were some of the barriers to her own healthcare. So that was huge for us as well. Okay. And does anyone have any questions at this time before I go into my questions?
Hi, I have a quick question.
Sure.
So when this mom came to you with the child and you learned about her past trauma and her living conditions, but how was it that she did come to you in the first place?
So basically, the physician just brought her to my office with no knowledge of what was going on, kind of just see what's going on with her and see how we can help, because they're not coming to their appointments. So I'm glad that the physician did that, because otherwise they would have just left their appointment and carried on with their day. But so when she came into my office, I just kind of was trying to dig, and I was like, is there anything I can help with? Anything at home? Anything in the community? And then I told her that we were noticing that they weren't coming to the appointments. Is it transportation? And just kind of digging and asking those questions, but being empathetic and cognizant that there could be more, just due to what we were seeing too. And then that's where she just broke down and she started crying and opened up about her history. And I didn't expect that. So I was, again, like, thanking her for opening up and hoping that we could help in whatever way.
So this was in the course of routine health care. So in the midst of all of her trauma and her living conditions, she was still keeping up with the health care of her children.
Exactly.
Right. Interesting. That's great to hear that she was able to get help.
Right. And we were so thankful that she came for that appointment, because we knew how much it took for her to get there.
Yeah.
Thank you. Any other questions?
Jocelyn, I also wanted to comment, I know you had talked about the level of food insecurity as well that this family was experiencing. And I think, as well, it's another great thing just to assess, especially with, if a child is being seen for any type of behavioral disabilities. It could actually be low blood sugar, or they're malnourished, right? They're not getting the right amount of nutrients. So that also plays a really, really big impact on overall health and well-being, and just that child's functioning, right? Because if they're not getting those nutrients when they're younger, their growth is actually stunted throughout their entire lifetime. So it's a lifelong, permanent, irreversible change that happens. So thanks for bringing that up.
Thank you. Yes, of course. And I think that was huge, and is still going on at the hospital, that connection that we made. And we now had a closet there in Children's Specialized in Newark with just food donations. So if anyone mentioned anything, we've even had parents come in and say, like, oh, do you have a snack for me? Like, we just ran from here and here and we didn't have time to eat anything. So just having that available, I think, just shows you going the longer mile, is like showing the family that you care and that we're there for them. So I think hopefully that's really helpful too.
The food banks are always looking. I know Community Food Bank of New Jersey, which primarily services the northern region of the state, as well as some southern counties. They're always happy to link up with an agency to establish a food pantry on site, whether that's a hospital, a nonprofit agency, a governmental organization, a school, and it's really, really easy to actually set that up. And the food banks are just a great resource, because now they're, the focus is on health, because, the healthy choice is not always the easy choice. So they're really just trying to increase the healthier options that they're getting and that they're able to provide to the partnering organizations. So there's a lot of programs around fresh fruit and veggies and just healthier versions of canned items and shelf stable goods. And it's all completely free. So
Yes, it's incredible. I don't know if anyone here is from Newark, Beth Israel, but I always thought it was amazing that they have a farmer's market that they offer and accept food stamps and SNAP benefits like everything right there in the hospital. So there were certain days, I want to say it was like Tuesday and Thursday, that you could go in and get fresh vegetables, fresh fruit. And they also have a garden that they grow their own vegetables and their own fruit. So they're doing incredible things. I really love that whole mission. Leslie?
I just wanted to piggyback on that. I'm with a program that does exercise for Beth Israel.
Awesome.
And not only do they do that, but across the street, they have a Dr. Ron, a place where people can go learn how to cook the vegetables and what to do, what fruits are better, and how not to, load up on this, that, the other. So they have a lot of training going on. Yoga, they have a whole calendar that they go to. Before the pandemic, it was really active. They're just starting now to have something at the Dr. Ron Christian Health Center. But and usually they have a wellness walk also. So since the pandemic and whatnot, they haven't actually been able to have some of those things, but they still do. They have a mobile that goes around and called the Wow Mobile. And they will come anywhere. They're already booked up for 2021 and 22, but you could probably get on the list if you have something and you'd like to have them come. It's a sustainable mobile, and they give away plants and stuff that the people can grow, herbs and stuff that people can grow out there, and give recipes and whatnot.
Wow.
So
and what is this
anybody, yes, from Beth Israel, you can just call them. It's the Wow Mobile. It's the Wellness on Wheels.
Wow.
And they have a tour. They show people how you can grow it yourself, and they always test out something new, a new vegetable or new fruit that people usually don't do, that might help, like with potassium or whatever. They have a whole thing with a chef and everything.
This is Lorraine Gibbons, right? This is the Newark. It was the Hydroponic Gardens in
Well,
Newark.
no, that's something different now. That's downtown Newark.
Oh, okay, that's wonderful.
That's downtown Newark.
And this the Wow Mobile, is that the one that was started at Robert Wood Johnson Barnabas?
Yeah, no, it was actually started at Beth.
Oh,
That's where it came
really?
through. Yes.
Oh, that is
Mhm.
wonderful.
Yes.
Yeah, I know about it. We have a colleague, Dr. Jamie Pula, who's on our board of trustees, who is a registered
yeah.
dietitian who was part of, do you know Jamie?
Yes. Mhm.
Yeah,
Yeah.
she was part of this. That's wonderful.
It's
That's
really a great program, and they will come and go anywhere. So if you're having a health fair or something outside, they actually came before the pandemic in Bound Brook. I was doing a health fair for the high school. They were there. So they will come anywhere in New Jersey. You just have to get on their list. I don't have it right now, but I'll make sure I'll get it to Michelle, the number for Molly. So that way, if anybody would like to register, have them come and do their fantastic work. They're always looking
Wow.
for places to go and places to help families learn more about how they eat. Because a lot of the farmers market, they found that people weren't picking up certain things because they didn't know what it was.
Mhm.
And nobody ever talked to them about anything. They might have known okra and they might have known, but butternut squash, they never seen it outside of a store. So they
Mhm.
never would pick that stuff up, and they're huge. I mean, their garden is abnormal. Strawberry, blueberry, they have everything in there. And then they can volunteer and get certain shares for themselves. So it's a good
Wow.
program.
Thank you. And you'll give us this information so we can include this in our resource packet, right?
Yes, I'll make
Oh,
sure
that's
I'll have to call her because I don't have, with the flood, most of my stuff, my files and stuff are gone. But I'm working on building them back up. So I'll make sure I'll
wow.
reach out to Michelle and give it to her because I know I have Michelle's stuff.
Thank you, Leslie.
You're
Great to
welcome.
see you here today, by the way.
The flood is taking out a lot. That's all I can say.
Wow.
Yeah, it's so great to have you. Thank you. This is incredible resources.
Thank you so much. And I'm sorry to hear about the flood. I know, are you located in Bound Brook?
I was in Manville. We're in a
Manville.
hotel now waiting for it, see if we can
Wow.
find somewhere to live.
Oh
I'm
my
not going back
goodness.
to Manville, that's for sure.
I'm so sorry. Yeah, it was
No,
so bad there.
but we didn't lose any. I mean, Manville, with all the water, no lives were really lost. Some, I mean, like some of the things happened to people, but we didn't have a lot of deaths, which was really a positive.
Oh my gosh. Well, thank you for all that you do. And I think I heard you say Molly too from Newark Beth Israel. I think I know who she is. She works within the nutrition department.
Yes.
And she gave me a tour of the garden that they have outside,
It's
which
great.
is super amazing. And even just having community members volunteer there and see how they can garden and learn and bring that home and grow, like you said, vegetables that they've never used before, seen before. So it's really a huge movement. I love
Yeah.
that.
And they have cooking classes. Michelle, you would love it. They have cooking classes. Ron
It's
Christian's
right up my
daughter,
alley.
Ron Christian's daughter comes once or twice a month and teaches them about how to be nutritious and how to lose weight in a healthy way. It's just amazing. They really, so, they just started slowly coming back up, but I wish they would try to microcosm that in other places because their program is excellent.
Wow.
I'm glad
Thank
to be a part of it.
I know. This is amazing. Thank you so much for sharing that. And if anyone else has any other resources, please feel free to write in the chat or jump in. It's super helpful, I think, to share because there's so much out there and we just don't hear about it, don't know about it. So that's why I love these echo groups. We can all share here. Okay, so these were the questions that I had written down for you all. Feel free to jump in if you have any other questions, but I was wondering how can we better assess our patients and clients as a whole? So besides ACEs screenings or social determinants of health screenings, is there anything that you all are using or a way that you think is helpful to assess our patients and clients as a whole? I think, Yvonne, are you raising your hand? Oh, okay. Anyone have any ideas, or do you see that that's a barrier too?
With the flood, I see a lot of people mental. They have a lot of problems. People aren't realizing how much a traumatic experience they've been through. And most of my clients, I had to encourage them. Red Cross had chaplains, they had imams, they had, if you need to talk to someone for your mental health after being through such traumatic experience. And most of my clients said no. I'm not crazy. That's the first thing they told me. I don't need it. And when I told them, I said, I did it. I said, because once I got finished taking care of you all, I had to take care of me and my mom. And it was rough. You know what I mean? And I said, yes. The person called me, prayed with me, asked me some questions, and, kept me focused on what did I need and what I needed to do. So I encouraged all of them to, to reach out to them because Red Cross, even though they're not exactly with us in New Jersey anymore, that part is still functioning. So if you know anybody who's been through the flood and they're not sure how they're feeling or whatever, they can reach out to either Catholic Charities or the Red Cross. There'll be somebody to be able to talk to them. And Richard Hall too, they were excellent during the flood too. They were right there.
Wow. Thank you for sharing that. And I think I heard you also say self-care and mental health for us, right? As
Yes.
providers, as healthcare workers, I think there's a movement with that too, but it's still difficult, right? Like our workplaces say, like, take a moment to breathe and do yoga and take care of yourself. But at the same time, we're feeling overwhelmed and there's a lot going on. There's a pandemic, there's flooding. So it can be difficult and kind of easier to say than do, but I love that you touched upon that as well. I see some comments here. Did you want to jump in, Michelle? I heard someone jumping in.
Yeah, and I had a question, Jocelyn, like if you've experienced this or anyone on the call today has, in terms of, there's a brief questionnaire for the adverse childhood experiences that some hospitals and practitioners are starting to use and really integrate into their practice. But I wonder if this is like hasn't really set in yet for providers that are specifically serving the this population of individuals with intellectual and developmental disabilities, if the training has been there. So I wonder if there's like any differences with what types of screening are actually happening.
Sure, that's a great question. So right now there's not a ton of research, and I think that that is the barrier, right? Is that we want to move forward and use these screeners, but at the same time, there's varying opinions on them. There's a few different ones out there. I know at Children's Specialized, we kind of created our own based on others that we saw. We made some changes. We have family faculty within Children's Specialized, and I'm not sure if everyone's aware of their role, but they're parents of children who have been served at Children's Specialized. So they have that better understanding and empathy of having a child within the hospital. So we had them review our questions, and they had a lot of concerns of how we wrote the questions, or like what was asked and how it should be presented. And the parents should be given a choice if they even want to answer these questions, because some families don't. And we did have families that said, no, I don't want to answer these. So I think that was helpful to have that perspective as well. But that's a great question. I think there's still a lot of research that needs to be done, and is happening at this moment. So I hope that that can help us in the future.
Definitely, yeah, and it's always a resource connection too, because if you do those screenings, you have to be really set up to make sure that, if things are coming up, that parents, families, and individuals can be connected with the right resources for support.
Exactly. And you don't want to re-traumatize anyone. You don't want to ask a question and then not have, like you mentioned, that resource available. And it's like, oh, okay, what do we do with this? And that did come up a few times. We had parents reveal that they were feeling depressed and down most days, and we realized that we had all these resources for children but nothing for the caregiver, for the adults. So then we had to pull that question, because we were like, we're asking this question, but we have no connection in the community to help them and to do that warm handoff. So that was something we were working on as well. So definitely, thank you, Michelle. And I see Amelia Hamilton, she had mentioned we've utilized the WOW bus at Special Olympics and Jay, and our athletes love it. We also had Karen and Lorraine come to our complex during the summer to talk about the hydroponic garden, and they brought fresh ingredients. It was a big hit with our athletes. Oh, that's awesome. Karen Bastow does cooking demonstrations with our athletes. I highly recommend. She is great with our population. Awesome.
Great
Yeah.
work. It really is. And I'm really thrilled to say that these people whose names are coming up are friends of the North Jersey Health Collaborative. And it's glad to see that, we are far and wide really connecting on a lot of the same issues and having an impact. I have a question about transitioning into adult care, because we've got Catherine Thompson, APN from Atlantic Health, who presented a couple of weeks ago. And next week we'll have Alicia Mira, who's on the call today. And a lot of the conversation will overlap. So when we're talking about trauma in informing care, and we're talking about the children's trauma in healthcare, do you have any experience counseling families where there is a child transitioning into adult services who is having difficulty based on, just fear of receiving healthcare and the behaviors associated with that?
Definitely. I think that's huge. And I'm glad that you're bringing up this topic, because we found that this was just a huge gap in healthcare in New Jersey in general. I'm not sure if it's across the country, but within our areas where I was working, so Newark, Jersey City, Bayonne, when it was time for them to transition, we found that not only the child was scared and fearful, the parents are too, because they've been within the same healthcare system, our hospital, Children's Specialized, since the child was an infant or since they were a toddler or younger. And so now they feel like we're just kind of pushing them out the door, and they're like, whoa, we need all these services that you gave us all these years. But then they're scared that they're not going to receive that afterwards into adulthood. So just kind of preparing them. So we started the transition we started talking to parents around 14, I want to say, and making sure they understood guardianship and making sure they understood how to apply for DDD and what services are out there, what resources are out there, and letting them know, asking them where they lived and kind of finding what resources were around them, programs and just things like that within, like, after they graduated from school. So just preparing them earlier was our mission, because we felt like a lot of parents weren't even aware of guardianship when the child was already 18 years old. So that was a concern of ours, because we couldn't even talk to the parent technically about the child's medical records because the child was an adult. So that was concerning, and something that we had to discuss as a hospital as a whole. So that transition's hard, not only for the child, but the family in general. And we had families begging us, please let it see my child until 21, or please don't let us leave. And we had some patients come back. We had some that were being seen even for physiatry in their 40s, just because they couldn't find a proper physician that could help with a child, with an adult with disabilities, like some of our physicians were able to do. So that it's a huge gap, and something I wanted to ask some of you all too, how you deal with it. But it's something that we noticed is hard, and we've just started preparing families earlier.
So if you don't mind, if I might ask a question about your experience at Children's Specialized. So it's Children's Specialized. So at what age does an individual age out of services at Children's Specialized, or do you expand it beyond that 18 or 21 years?
So it's supposed to be 21 years. And that was the hard part, was the doctors kind of have their say in that too. So like I have a family in mind that I'm thinking of, that we transitioned earlier than 21 because we felt that he was ready to go. He really needed psychiatry, was what he needed, and not really a neurodevelopmental pediatrician. So the doctor had asked me to look for psychiatrists out there. And that was just a whole different barrier too, because there's not many psychiatrists that can work with a young adult with disabilities or with autism. And we had to really dig for that too, and create connections with Jersey City Medical Center and ask them where they're sending their patients. So it's just, you can see it's a gap within healthcare, because even Jersey City Medical Center was like, we don't have anything either. Do you guys have anything? We're like, no, we don't. That's why we're calling you. So kind of going back and forth. And then we found that Hackensack had a psychiatrist that was seeing young adults with autism. So that was great. But then now that's the only place we have, and they are booked. So definitely a barrier.
So it is our hope over this Project Echo, again, over the next couple of weeks with Alicia Mira, and then with Deborah Spitalnik, who teaches medical students at Robert Wood Johnson Barnabas, that, through conversations like this, we can create more opportunities for care for the adult IDD population, which clearly there is a great need, right, for expansion of care in this area.
Has anybody checked out Trinitas?
Nope.
Because I know my niece, she's an adult now, but her mother had her while she was still on drugs and whatnot. And so my sister had an open adoption with her. And she connected with her mom and the rest of her family later on in her life, but she had a lot of problems. And Trinitas in Elizabeth has a big program, an excellent program. And they're the reason why she's such a wonderful Dumas now. She's in Pennsylvania living her life. She has a daughter and had been married, divorced, and been through life really well. Now she's helping people have their children in a healthy way. So Trinitas, I know that they have, they take care of teenagers. They helped her from the time she was about 7 or 8. She was in Children's Specialized for a while. And then Trinitas took over as she got older. So I know they have a very good teenage program that helps people who either have mental disabilities or ADD, various things. And I'm not sure how they deal with autism now, because I've been out of the childhood workforce for about 10 years now. But that I know of, they're still doing it. So that might be somewhere a good connection also. They have people who spoke to her. All she had to do was call them at any time, and somebody was able to help her through whatever she went through.
That's good to know. I understand that in our Union County work with the Shaping Elizabeth coalition, Trinitas has been involved. So thank you, Leslie, for that, because there is a wonderful opportunity for us to follow up and include these types of service in our upcoming community health improvement plans.
Definitely. I think also a barrier for us all the way in Jersey City was transportation there to Trinitas and like families that didn't have cars. So we wanted to use those services and others around the state, but then getting the family there and then after school, and that was just difficult too. So that transportation piece is always something that comes up. But I appreciate that. Thank you. Laura, do you want me to continue to go through my questions? Did you want to?
Oh, no, please continue. We still have 13 minutes. So
Okay.
anything else you want to share?
Okay. Let's see. So how can we best provide resources and support when needed? So I think we've kind of touched upon that. Just having those ready, that information that we need for the families to best support them. Oh, this was actually something that came up with this family too. So I had written, after a family reports all of this critical information, if we're not able to reach them again after the appointment via phone or email, how can we best support them? So that did happen with this family. Mom revealed a lot, unloaded a lot of information, and I called to follow up to see how she was doing after that, if she was okay. And support her even more. And she didn't answer for a long time. And that was heartbreaking to us because we wanted to help her in greater ways. We wanted to check in, make sure she was okay. And we didn't hear from her at all. So I wanted to see if that's happened to others, or if you have any advice for how we can get them back into the office or be able to support them better. Has that ever happened to anyone else here?
I'm sorry.
Lovely. Awesome. No, tell
Shows
us.
I haven't been on all the calls, right? Sorry.
No, this is helpful. Thank you
But
so much.
we had a family that had that problem, and I realized that she always went to the same store in the area where she was, regardless, like to play her pickets and stuff like that. So I talked to, once I found out where, I said, well, can we meet? What time do you usually go play your pickets? And she was like, why you don't try to take my numbers. I was like, no, I just want to know what time, so we could help you somehow. And she said, oh, that'll be a good place because I go there every day. And all for a whole month, nobody could reach her or anything like that. And nobody really thought about that. But she always had like a little bag with her, and a little coffee when she came. And so that's one of the things that I realized. I'm like, if she does that every day, that's a good place, So I asked the guy, I said, if we leave a packet for her, could you make sure she gets it? And he was like, yeah. She comes in every day. Yeah. She's one of my good customers. And so that's what I start doing, is finding out from them as I talk to them some of the activities they did during how they did their day. I didn't really like ask them out, but it made me realize that back in the day we didn't have texting or phones or email. and folks who do the job that we do now somehow got in touch with their clients. So then I started thinking, I was like, all right, if they stay in a neighborhood, it's more difficult if for some reason, like with the flood and stuff, they're out of their neighborhood area, with people they know and people they see all the time, or who can say, yeah, her child goes to school every day. Who told you that? That kind of stuff, that they have some sort of network. And it might be, I like when you said a warm handoff, because it's more like a family kind of connection, even though it's not, because she went there every day. Wow. And that man could tell me, which I didn't ask him for. I was like, I don't really need to know certain things, but it helped me be able to connect with her. And when she got her phone, she gave the phone number to him. And then I was able to call her and reach out to her and make sure her kids were all right. So that's one of the things that I think that we don't really consider because, you know, we're in a computer age. But a lot of our families might not have these things. They might have them now. If they've been through any of this stuff with the Red Cross, they do try to make sure that they get some sort of phone or if they want one or something like that. But I found that that really helped me be able when I was teaching the kids, that made me be able to go and ask, you know, have you seen sister so and so? And he was like, yeah, she was in here. You just missed her. Come an hour before you did, and you'll see her yourself. And that's what I did. She was like, hey, how you find me? I said, I have my ways. I have my ways. But I think that that's some of the things that we don't think about as they, especially the fact that she trusts you enough to tell you her story. That's amazing because they don't have time for that. They usually, if they're taking care of their kids and making sure their kids have everything, they don't care what happens to them as long as they can protect their kids from some of the stuff that they've been through. So, you know, I thought that was wonderful how you said about having a warm handoff. And if more of us had that kind of experience, you know, as a community health worker, the problem with the state is that they don't recognize us as anything working in the community. But my fellow people that I know that are still cohorts that are still working, and a lot of them have gotten out because they can't deal with the rhetoric or whatever. But when we did get together, that's some of the stuff that we talked about. How do you manage in the neighborhood? You got to make sure that people know who you are, and if they feel trust. Children specialize. I love you all. I'm not going to kid you because I worked at Plainfield, and we had some children who just had a lot of issues that they thought was this, that, the other, and they labeled them, and then they get in kindergarten, they're still labeled. And Children Specialized helped us break a lot of those yokes. And it's like, no, that's not what's going on in his life right now. Who gave you that information? What are you reading? So I think that that's one of the things we need to find out what they call their network. Because every one of them have some sort of network. It might not be quote unquote family as we see it, but it is their network. And if we can figure out and make them feel comfortable enough to trust them, to trust us, then, you know, we can find out how we can manipulate and programs and stuff for them.
Yes, thank you. That was amazing, Leslie. And I love how you found your client and how you were going that extra mile to get her that information. I'm sure that meant a lot to her too. Like, wow, she cares. She cares about me. So that's incredible. Great. And is there anyone else that was able to reach a family in that way, like Leslie did, or have trouble reaching a family and find ways that were helpful? I know sometimes writing a letter home, like the old-fashioned way, can be helpful. Any other ideas?
I love those suggestions too, though, Leslie, because I think it's also more of a personalized connection that we miss in our communities today. Like the text messaging is great and the email reminders are great, but you know, it's also just meeting people where they are, right?
Mm-hmm. Definitely. Thank you, Michelle. It's so true. And I think we forget that.
Yeah, when dealing with adults in particular who may or may not be self-guardians, I've had the experience where many of them live in a group home setting, and some of the barriers that we experienced were related to the staff in the group homes. So one of the ways to overcome that was to actually, you know, make a phone call to a family member and have a family member provide some influence over the matter to help advocate again for the family member living in this independent setting. So, I mean, that's a whole other thing that's outside of the walls of healthcare. But when you're dealing with, you know, health issues and wellness issues related to, you know, secondary to a disability, that to me has been a challenge. And I found, again, that reaching out, even if it's a non-guardian family member, to, you know, get a little more support in there. So I guess everybody's got to come together and advocate, right?
It takes a village, as I say. It's true.
Yeah. Yes.
Perfect. Okay, so the last question I had here, or not question, but statement, which I think we've all kind of talked about already, was just remembering to use empathy versus shaming our patients and clients. So instead of the provider attacking the family, like, why haven't you been here? What are you doing? Like, you've missed all these appointments. She took a step back and was like, how can we support this family and see what's going on? Let me send her to the social worker. So I think that, again, that warm handoff is super important and kind of helps the patient to open up and the family to open up more and to see that we care. That's why we're asking, how come you've missed your appointments? We're not shaming them or saying like, you need to be here. We want to be there to support the child and the family. So I think just having that lens is super helpful.
Yeah, definitely. We are almost at time here. So if there's anything else you want to add now, or if anybody has any questions, speak now or forever hold your peace.
Thank you all for having me. This was
wonderful.
So great.
Yeah. Thank you for bringing your very special empathy and your expertise to this conversation. Again, my wish is that we all will continue these discussions, and as we move forward in the work of the North Jersey Health Collaborative and beyond, that these conversations are had and that everybody in their community health improvement planning processes and their healthcare administration processes thinks inclusivity and thinks of, in terms of advocating for our populations. So we have 2 weeks left to this project. And next week we have Alicia Mira, PhD from Atlantic Health, and she's going to be speaking on patient privacy and confidentiality. And that is something that we have not yet discussed, and a very important piece of this in enabling individuals with special needs to articulate or have the ability to communicate with their providers. And then following that, we have Deborah Spidlnick from Boggs Center for Developmental Disabilities on week 8. So we hope you can all join us next week and the week after and share our information out with your circles so that we can continue to advocate for healthcare and cancer screenings for folks with special needs. And I'll hand it back to Michelle.
Yeah, we thank everyone so much for taking the time out of your busy day to join us today, and especially a special shout out to Jocelyn. That was a wonderful case presentation. So thank you for guiding us through that and just sharing all of the great evidence-based practices. So we have a link in our chat box. It's just a quick evaluation, and we promise it's painless. It will take you about 30 seconds. We would just love your feedback about today's session because it will help us to plan future sessions. So we look forward to seeing everyone next Tuesday at 8:30 a.m. for our next upcoming Project Echo session. Make it a great week, everyone.
Thank you, Michelle. Thank you, everybody. Have a great day.
Thank you.